We want to deliver the best care we can to our patients, and that might be in enhancing our skills on the clinical floor, but the real value comes from being involved in creating the change and being a part of contributing to new knowledge and helping to develop and shape evidence-based practice for years to come.
What I'm proudest of is when I see as a study that EMF was able to support and help those researchers conduct and publish, which people all over the world see and which can change practice not just in Queensland but around the world. I'm really proud of that and I think that's fantastic.
EMF awarded its first research grant back in 2008, and since then we have awarded almost $18 million to over 200 research projects.
KPMG actually recently did a study for us to quantify the benefits that our funded projects are providing to society. And it was very impressive to see that for every dollar that is being invested in research, we are generating at least 50 times that in benefits for society.
The fact that EMF is there sponsoring and supporting clinician researchers is really why we have this enriched place in emergency medicines in Queensland for research, and the quality of the stuff that we produce here is influencing people nationally and internationally. So without EMF, realistically, I don't think any of this journey would have happened for me.
So what it really has allowed us to do is generate an infrastructure that works and really help us become at the forefront of emergency medicine research in Queensland and even Australia.
The Emergency Medicine Foundation grant I received directly contributed to the employment of the first ever Torres and Cape Hospital and Healthcare Service Indigenous Research Officer, Polista Pilot.
I think the most rewarding thing about EMF is that we are able to help researchers very, very quickly to fund their innovative research into emergency medicine and get that out onto the front line. So knowledge translation is very rapid with EMF, and we can see that turnover on the floor when we work, that a recent study from EMF will be implemented into guidelines and in practice in a relatively short period of time.
In recent years, EMF has proudly supported world-class research driven by nurses, allied health professionals, and for the first time this year, a paramedic. We join our medical colleagues.
And if you think about research that makes our system more efficient or improves the quality of the service we deliver, that touches the lives of more than 1 million people every year, and so it's really important that clinicians are engaged in looking at our systems and researching what we can do to improve our services.